have you gone private abroad when it comes to medical procedures? Get in touch, let me know. 0800 111 4041 is the number to call. You can WhatsApp 08000 321 333. Start your message with the word Essex. We are going to chat to Linda next from Colchester. Her name's Linda Lomas, and we often speak about how long your waits have been for surgery on the NHS or for checkups on this programme. Well, Linda was in a situation that I'm sure a few of us have been currently or in the past, a 4-year NHS waiting list to get a hip replacement. In the end, she decided to travel to Lithuania to get it done there privately instead. And she starts by telling me about the issue she was having with her hip.
Just before lockdown, I was put onto the list to have my hip replacement. That didn't happen due to the fact that I was having to take steroids at the time. So for 3 months, they said to delay it. I was deferred for 6 months. This turned out to be due in the March when we went into lockdown. So that never happened. Basically, about a year later, when things started moving again, I realised that they'd actually taken me off the list and had to start all over again. I was told at that time it's going to be at least 2 years, and by which time, when I first originally went, it was just like arthritis, and it was sort of not severe, but it was getting worse. By the time I actually got to wellness travels through wellness travels to Lithuania, it had become bone on bone, so I was in severe pain. My friend had a friend who had had surgery at the clinic, and basically said research. So that's exactly what I did, and felt very confident about going over there and having the hip replacement done. And
just expand on just how difficult your life was as a result of the wait and the postponement and the delays, you know, how bad things had got.
At the beginning, my mobility was fair, and then I was relying on using a stick all the time. I started to not want to go out, socialise, simply because of the pain that I was in, taking quite a lot of different painkillers, and my confidence went downhill completely. I didn't really feel like I wanted to mix with people because I always felt I was the person holding behind. I couldn't play with the grandchildren. I was working with children at the time as well, which obviously held me back. And I ended up actually leaving the work that I was doing in the end because I just couldn't cope with all the pain.
And that's obviously, you know, whilst that's going on, you're considering going private. At what point, I mean, did you explore going private in the UK?
I did, yes. It was just the cost factor, really. I mean, basically, even when I went to Lithuania, I had to get a loan to go out there. It's not that I've got lots of extra money, but the cost here was just extortionate. So I just could not get that sort of money together. I mean, basically, it was under half the price when I went to Lithuania, and that included everything, the travel, the rehabilitation, the hotel for my husband, the lot was still under half what I'd have paid here.
Do you want to talk figures, Linda, or would you rather keep that to yourself?
At the time, it was roughly about £7,500. So it's obviously a little bit more by now, but that was in 2023. So, but that was for 10 days. I was there for 10 days in Lithuania with the best physiotherapy I could ever imagine having. So.
And estimates in the UK were what, in excess of 15,000?
18,000 on the two hospitals, which were local to me, that I'd had quotes from.
Was there any point in your mind where you were a bit concerned about going to Lithuania? We hear a lot about, you know, the NHS being, you know, the best in the world, etc., and the best surgeons and that kind of thing. Did that cross your mind?
Basically, I did a lot of research. I did a lot of research on Dr. Linas and the actual clinic itself. As I say, I'd been recommended to go over to Lithuania with a friend who was also very thrilled with what the treatment she had there. I was never actually nervous. And when I actually got there, I was almost running into the theatre because I was so excited at the prospect of having the pain go away and feeling better again.
Linda talks about post-op in the next part, and we meet her surgeon Linas as well. who just tells me how common the practice that Linda and the decision that Linda took is. Talking medical tourism today. Have you gone private abroad? 0800 111 4041. What were the results, please? We've been chatting to Linda Lomas from Colchester. Linda had a 4-year wait on the NHS to get a hip replacement. She said her mobility was seriously being affected. She gave up her job. Such was the wait she had for the procedure. It got to the point where she opted then to do a bit of research and go to Lithuania to get the surgery done. She spoke about the cost in the UK privately being something around £17,500, and then taking out a loan to get it done in Lithuania for half the cost. Her orthopaedic surgeon is Dr. Linas Zeniauskas, who is based in Lithuania and has chatted to me this morning. And I first asked him how common it is for British people to travel abroad to see him for these types of surgeries.
Majority of my patients come from abroad. And at this point, there are some other countries that have also same difficulties. And my main source of patients come from Canada, and about 15% are from UK. So we see more inquiries getting to our clinic, the wellness travels, because we can offer the timely manner to a price that we're getting lower, but not because of the loss of quality, because our surgeons, when we train here, so a lot of them also go to work abroad, even in the UK, and all the trainings that we go through, we travel, we go to United States, we go to UK itself to learn how to do things. So I think we're at the same level. We use the same implants, the same techniques, everything's quite the same.
So, and that's what you'd say to someone who might be a bit reluctant to travel to Lithuania for a surgery. You'd say, look, we were trained in the UK. We're exactly the same.
Yeah, the quality wise, for example, we can measure it because we use registries to see how the outcomes go in Lithuania or in the UK, so we have the same results. So it's the end point, how much the implant lasts or the patient lasts, it's the same. The other thing is, like we have the quality and we provide the patients the whole package, even the rehab that goes afterwards. We try to make the patients to be independent when they get home. It's not like a nowadays surgery, we don't do that. We keep the patients in the hospital with a rehab facility, and they stay there for 1 week. So it's just to get you back on your feet and be able to move around when you get home. And
if more than 1 week is needed, or there are any kind of complications, Linas, is there flexibility in that?
Yes,
in
definitely. So as any surgery, so replacement can have its own complications. The acute ones can happen rarely. It's if you're a healthy patient, so it's less than 1%. And we have the backs of university clinics that we have the arrangements. So if anything happens at that point, so you get all the treatment that needed. And of course, we can push up the flights until you're well. It's not like we see something's wrong and you're just going away. No, we keep the patient safe, and until it's safe for the patient to leave.
Linas, just out of interest, I just wonder what you think of Linda's situation. The other people flying over to you, the fact that they live in the UK, they live in Canada, and they're struggling to get treated in their own country. Just as a professional from overseas, how do you view that situation that Linda and so many others find themselves in?
Well, I'm sorry that the system is not perfect. Although in our country it's also not perfect. So we have other issues, and also waiting times in some different hospitals can also exceed 1 year. So this is when patients turn to private hospitals, which can afford the help they need.
And Linda, we'll end with you. I mean, describe the Linda before the hip operation and the Linda that is now.
A lot happier, a lot more confident. I've been able to do around Europe on my own or with friends. With confidence. I've got no pain. I walk totally normal. That's due to the physiotherapy I think I got at the through Wellness Travels. The fantastic team that they'd got there made me realise I was capable of much more. So now I am able to do exactly what I want. I take my grandchildren away on holidays. I take them sort of shopping and things, which I just stopped doing everything like that. So yeah, I feel like a new person now.